Hello, my name is Dubraika Pichardo. I am the research coordinator of the MaxiMoM study. Dr. Simone Bass and Dr. Debbie O'Connor are the principal investigators. Today, I will talk to you about this new trial. For both mother's milk and donor milk, nutrient enrichment is needed to support infant growth of very low birth weight infants. This is called fortification of milk. There are 3 fortification methods. The method that is a standard of care in most NICUs is called a standard fortification. The nutrient composition of the milk is assumed to be fixed, so 1 dose of a human milk fortifier is added. It's a one-size-fits-all approach. But as we know, the nutrient composition of milk does vary. So a way to individualize fortification is to first analyze the nutrient composition of the milk, then we can fortify it accordingly to meet the target goal of the recommended nutrient intake for these babies. This method is called target fortification. The third method is called BUN adjustable fortification. This method tailors the protein supply in the feed to the baby's metabolic response to the protein intake, measured by BUN. A dose of human milk fortifier is added to the feed, and if the blood urea nitrogen is below 3.6 millimoles per liter, more protein can be added. So in this study, we are comparing these 3 fortification methods to see which one will yield a better result in terms of growth, that is weight, length, head circumference, and body composition. Our main inclusion criteria are babies that are born 1250 grams or less, with consent to use donor milk as a supplement, and that do not have a congenital or chromosomal anomaly that will interfere with growth. Recruitment will take place at Mount Sinai Hospital. Our goal is to recruit 345 babies. Of those 345, we anticipate that 43 babies may be transferred to William Osler sites for participation. Participation will continue at William Osler for the remaining of the study. These are the 19 participating sites. They are all over the GTA. As for the intervention, mother's milk will be given first, then donor milk as a supplement. Infants will be randomized to one of the intervention groups, a standard, target, or BUN adjustable fortification. Feeds will be blinded. That means that neither you, nor the clinical team, nor the research team will be able to know what is the baby's allocation. Only the people in the milk preparation room will be able to know this milk, to this group allocation. The intervention will stop at 36 weeks gestational age or discharge, whichever occurs first. At the end of the intervention, the study staff will do an anthropometric assessment and collect a buccal cell sample. Here are the feeding guidelines. These are in accordance to the standard of care at William Osler for these babies, and they will be available in the study binder for closer inspection if desired. So how will you know that a baby is a part of the study? We will call the nurse, the chart nurse, to inform of the baby's transfer, and we will place the study consent form in the baby's binder. Also, we will place tag at the bedside, such as these. Donor milk or mother's milk feeds will be prepared at SickKids milk preparation room and delivered daily after 6 p.m. Please use the fact sheet to place orders by 1 p.m. Mother's milk for 24 hours worth of feeds will be collected on mornings before 12 p.m. Please label each container with the patient's ID label and call the study pager to inform if there is mother's milk for collection. Because it's a double-blind randomized clinical trial, only the milk preparation room staff will know the baby's feed allocation. So the feeds will be labeled as MaxiMoM study fortifier and the caloric strength. For weaning, there's a specific protocol. So please notify the study staff of potential discharges. We are collecting a stool sample once a week for the first 8 weeks of the study, and we're asking help from nurses to collect this sample from the diaper. Just scoop a raisin-size amount of stool from the diaper and label the container with the date of collection. The specimen kit then goes back into the thermos container packed with ice and inside the cooler bag. The study team will communicate with you as well as the attending nurse to ask whether this is stool sample ready for collection. The courier will collect the stool kit and bring it to SIP kits. If there is no stool available, the courier will collect the stool collection kit and replace it with a fresh kit the next day until a sample is collected. The study is expected to start in September in Sinai, and participants' flow to your site is likely to start during November and December. The study will run for 3 years, and we guess the take-home message is that we have a 24-hour pager, so we're always available to answer any questions. Please do page us, and have a good day. Thank you.